So now you know that you will lose a tooth. A tooth has to be extracted. You are informed by your dentist that that tooth is lost and has to be replaced with an implant. How does this function? Ideally, I will see the patient before extraction, do the dental scan, determine exactly the volume of the bone, and then I will decide whether it is opportune to do the extraction and the placement of the implant at the same session. Nowadays, we very often do the extraction the very same day as we place the dental implant. There is no problem placing the dental implant in a fresh socket. There is no problem in placing the dental implant even if there is some degree of infection around the tooth. Because when we do the extraction, and that is why I prefer to do the extraction instead of leaving this to the dentist. When we do the extraction, we meticulously clean out the extraction socket in a way that we have bare bone, that we have healthy bone, that we've got a solid base to place the dental implant. Once that the dental implant is stable, eventually you may have a gap between the surface of the implant and the wall of your socket. This is due to the shape of the roots. We do not have cylindrical roots. We have got roots that are ovoid, that are differently shaped, and we place a cylindrical implant that leaves little voids on the side of the walls of the implant. Those voids will be filled in with biomaterial, eventually mixed with a little bit of your own bone cells, and the implant will grow, the bone will grow, and everything will function when we do this in the same session. If you do the extraction though before, and although everything is eventually cleaned out properly by your dentist, it may be more difficult in a later stage, 6 weeks or 3 months or even later, to maintain the bone volume of the socket in the same way as when we place the implant the very same day. That is because of biology of the extraction. After extraction, we see that there is a collapse of the buccal bone, and very often when people come in with a tooth missing for years, you will see a depression in the gum where actually the bone has resorbed. To avoid this resorption, we today very often place the dental implant at the same session as when we do the extraction.